Hi, everyone. Thanks for joining today. We are just waiting for some more people to join, so I think we're due to start at around 3 o'clock. So just bear with us for just a second, so we'll see if anyone else is coming to join. But we will be starting shortly. Okay, as we haven't got necessarily very long for this session, I will start sharing my screen now and get you started for this presentation. So thank you everyone for joining. I'm Joshua Costa. I'm the Country Development Manager for Europe at the University of Southampton. And with me, I have at least from Humanitas University, who will be telling you a little bit more about studying medicine in Italy later. But I'm going to start you off with studying in the UK first. So just quickly, a general overview of what we're going to be talking about today. So the kind of courses that are available, teaching methods, course structure, additional opportunities you have, entry requirements, how to apply, and then finally end a little bit on fees and funding and careers opportunities. So what kind of courses are available for study in the UK? So the main general flagship program is the 5-year medicine program. And then there are some other options as well. They might not be as relevant to you, but I just wanted to quickly fill you in. So there's a 4-year version of the course for graduates, so anyone who has a degree. There are some programs that have it with a preliminary or foundation year, and this is often if you don't quite meet the requirements, or if you haven't studied the exact correct subjects for entry, then you can often do that as an option. That is not something we have at Southampton specifically, but other unis might. And then finally, medicine with a gateway year, and this is typically used for widening participation, so for students from disadvantaged backgrounds, for instance. But in this case, that's UK only, or for those with home fee status, which might not be applicable to all of you, so I'm not really going to be covering that. I'm mainly going to be studying that standard entry for medicine. So just a quick idea of teaching methods. So there are some key teaching styles, and the first is traditional. As you might expect, that's kind of the method that was started with. The idea would then be that you learn all of the scientific theory first, and then you start moving on to clinical settings such as patient contact. Typically, only really Oxbridge teach in this way at the moment. And a lot more universities, for instance, use problem-based learning. So this is a lot more patient-centric. You'll often have patient contact really from the start of your course. And the idea would be that you kind of learn to solve based on a problem case that you're given. And the idea is that you're then in a small group, and you kind of have a tutor where you set your own learning goals based on, what problem is there, how do we solve this, and what do I need to learn in order to solve this problem. So it's really focusing on bringing an application of knowledge and skills to solve these problems. There's also case-based teaching. This is actually quite similar to the problem-based one, but often it focuses on specific patient cases and even some that you might encounter in clinical setting. So again, patient contact early, And then finally, there's a kind of an integrated system which takes all of these to some degree. So that might mean that patient contact will be a little bit later than in problem or case-based, or it might take various elements from all of these options. An integrated style medicine course is what we teach at Southampton. But do make sure that you look into what kind of teaching style or learning style your medical school has, because you might prefer one over the other. So quickly about the course structure, as I said, standard is about 5 years, with the first two are really based on the fundamentals, where you learn a lot of different things about sort of like main key components for medicine. And as you can see, medicine in practice is something that you'll have at Southampton very early. So you'll start having patient contact essentially from the first weeks in your degree. The third year is really kind of your transition to clinical practice. So that's when you'll have kind of larger placements, and your final 2 years are really fully delving into that clinical practice, often where you have placements over weeks at a time. Something to consider are additional opportunities. So outside of your Bachelor of Medicine, Bachelor of Science, or BMBS, as medicine is also often known as, you'll get a Bachelor's of Medical Science. That's kind of the standard that would fit into that 5 years. But what you can choose to do as well is do something what's called intercalation. So most universities will offer this, and it's a chance for you to either do a year abroad at a university and study a master's there. You can do a master's in your home university or a different university in the UK, or maybe even a third years of a bachelor's and get an additional degree that way. And finally, it's also an option to do a medical elective. So at Southampton, we offer this in the final year, and it would be 7 weeks in total. And again, this kind of offers you a chance to go into a department or hospital that you're not normally doing your clinical placements in, and kind of get experience in a different place. And again, if you can arrange this could be abroad as well. So getting into entry requirements quickly. So places will vary a little bit per university for how many they have each year, but at Southampton we have 10 to 11 places for international students. There are about 20 applications per available place, so it is a very competitive course. Depending on your requirements, I've written IB on here, but I'll cover OIB and French back in a second. But we looked for an overall score of 36 points, with 18 at high level. Biology is the most important subject, and then you can study either of the other ones that are listed on the slide as your second base science subject. If you're taking either the OIB or the French baccalaureate, we look for a grade 15 overall, with 15 in the two key subjects, again, biology and one of those other ones. We also look at sort of like your year or your qualifications when you're 16 for GCSE requirements if you haven't taken UK GCSEs or IGCSEs. So we'll kind of review those qualifications then, but often we're looking for a strong base again in maths, biology, and chemistry. And we kind of want to see if you have good English language qualifications as well. If you've done the OIB, we would accept a grade 11. If you're doing the IB, we would accept a 4 for your English syllabus A, or if you're doing syllabus B, we'd look for a grade 6 at standard or a grade 4 at higher. And then finally, the UCAN or the BMAT. So these are more like aptitude tests, so they're not necessarily knowledge tests, but they test things like verbal reasoning, your decision making, your abstract reasoning, and there's a situational judgment test as part of this as well. Again, a little bit different per university for how they use it. At Southampton, we'll rank all applicants based on their UCAT score from high to low, and we will invite all of the high scorers to our interviews until there are no longer interview places left. Whereas some other, this means that sort of like the lowest UCAT score that is invited for interview each year fluctuates. Other universities might use a specific score cutoff, depending on how well everyone has done that year. So that's why we have a little bit of a range. And for 2021 entry, the score was 2,710. And we would kind of expect this to be the same for the upcoming academic year. But as I said, because it fluctuates and we can't really say that with certainty, but it's just to give you an idea of the kind of ranges of scores that we would have been looking for in the past, say, 3, 4, 5 years. And of course, for other universities, please check medschools.ac.uk. They have comprehensive information about everything from English language requirements and the other standard academic requirements too. I'll cover how to apply quickly. So applications, as you may know, go through the Universities and Colleges Admission Service, or UCAS. You'll need to prepare a personal statement. Now, for medicine, at least at Southampton, we will often not use this as the basis to consider you for interview, but it's more used as if you are invited to interview, it would kind of be what we would base certain interview questions on, or kind of have it as an introduction of you as a person and kind of ask you questions based on that. We would ask you for your education so far from the age of 13 plus, and you need to provide a reference. This is often your teacher or tutor or someone from your school. Now, something to remember is that the application window is very short for medicine. So applications opened about a week ago, and they'll be open until the 15th of October. Many medical schools, Southampton included, will not consider any late application. So please make sure that you submit it on time. And then in the assessment itself, we'll look at your predicted or achieved grades. As I said, your personal statement is not really used to decide whether you'll be there for a selection day, but it is still important to put sufficient time to kind of describe yourself in it. Your reference, and as I said, your UCAT score, as I explained earlier. Now, quickly moving on to fees and career opportunities. So as I said, EU students are now classified as international students at most UK universities, which means that they'll also be classified for international fees. There are not many scholarships for medicine, and scholarships that universities do have often don't apply for medicine. So it's not something you should probably rely on, but do check individual universities' websites for more information. Fees differ slightly per university, sometimes for the preclinical years, so those first and second years, the fees are slightly lower, and in the clinical years, those final 3, it's slightly higher, or sometimes they have more flat fees, but in general, it'll roughly even out. And what you might need to consider as well is if you're doing medicine in the UK, it's 5 years for the actual medicine program. Then you'll have what's called the UK Foundation Program. So they're 2 years in total to kind of fully gain your registration. So after your first year, you can register as a doctor with the General Medical Council in the UK. But if you complete that second final year of that foundation program, you can kind of enter a core specialty or general practice training program for a doctor. So for instance, if you wanted to go on to be a neurosurgeon, just as an example, that would require further training, and the UK Foundation program and completing that would allow you to do that. And of course, if you would want to become a doctor in France afterwards, typically studying abroad and practicing these kinds of degrees abroad and then returning home, you'll need to check with your national body to see what the sort of like requirements for this are. For France, this is the Conseil National de l'Ordre des Médecins, so please make sure to check that with them. There might be some additional restrictions or opportunities due to Brexit, but I think most of these have yet to be fully ironed out. But please make sure to check on their website and get in touch if that's something you're interested in. We might have time for a short Q&A. If you do have questions, pop them into the chat. But please feel free to also email me or just drop by our booth later. In the meantime, I think I'm going to hand over to Elisa for her presentation. So please feel free, Elisa, to share your slides now. But as I said, please feel free to drop any questions in the chat or to join me in my virtual booth later as well.
Thank you so much, Joshua. If you agree, I will start with the presentation.
Yeah, please do. Go ahead.
Okay, thank you. So hi, everybody, and thank you all for having decided to attend this webinar regarding studying medicine. I am Elisa Commentale, and I work for the Orientation Department in Humanitas University, which is an international university for life sciences based in Milan, which is the capital city of the Lombardy region in Italy. We offer 2 international degree courses. The first one is Medicine and Surgery, which is a 6 years course that hosts every year 130 European students and 50 non-European students. The second one is MedTech School, which is a brand new course that allows students to obtain 2 titles. So a master degree in medicine and surgery, together with a bachelor degree in biomedical engineering. In this course, every year we host 60 European students and 10 non-European students. I would like to underline that both courses are entirely run in English, and I think this gives you a boost in your medical career in terms of postgraduate opportunities. In fact, both courses, so both the medicine and surgery degree course as well as the medtech degree course are fully recognized all over Europe and in many non-European countries, for example, UK, USA, India, Turkey, Israel, and many others. So in this way, our students, after the degree, can choose. We already have some students that after their graduation decided to stay in Italy, basically because they fell in love with the country and now they are working as general doctors or they are attending a specialty school here in Italy. But we also have many other students who decided to move and start their specialty school, their residency or foundation programs abroad. In terms of university community, the 40% of our students come from outside Italy. I would say that what makes Milan, and especially the Lombardy region, so attractive for all those students who want to start their medical course, their medical studies, is that the Lombardy region is considered as a model, and it is recognized, in fact, as one of the most innovative hubs in Europe, thanks to its healthcare system and the related technologies. Just to give you an example, all our students in their medical path carry out their clinical activities in Humanitas Research Hospital, followed by doctors and clinical tutors individually. Consider that the hospital has ranked as one of the top 40 hospitals in the world's best smart hospitals in 2021 ranking. Another important feature of the medical course is the full integration between theory and practice. So during the degree, you will learn not only in class, but also in the words of the Humanitas hospitals and in our simulation center, which is a high fidelity center that realistically recreates some hospital rooms. In here, our students can start to put into practice what they learn in class, thanks to the presence of high fidelity dummies, which have almost all vital parameters of a human body. In order to access in order to access in general the medicine and surgery degree courses in Italy, there's always an admission test. there is a difference between public universities and private university. So for all public universities, the admission test questions are related to logic, mathematics, chemistry, physics, and general culture. Instead, the admission test of our medicine and surgery degree course in Humanitas University, which is a private university, is slightly different because, as you can see from this slide, the 60 multiple choice questions are all related to the logical area. Of course, there's a difference between the two admission tests, so the one for medicine and the one for medtech, because since the medtech school merges the medical education with the biomedical engineering one, also in the admission test, there are some questions regarding biology, chemistry, physics, and mathematics. Another important difference between the national admission test and our tests is the timing. So for all public university, the national admission test usually takes place in September, while our admission test takes place in February. So for example, if you want to start your medical career in October 2022, then the admission test you should sit and pass is in February 2022. And for this admission test, we will open the registration soon on our website, specifically in mid-October. In terms of requirements, it's easy to register for our admission test and to enroll in our medical course, because for all students, also for the one who are attending an IB, the only entry requirement that we ask is to have at least 12 years of education. Of course, as many other degree courses, we offer preparation week courses to prepare for the admission test in the best possible way. We also have lots of services that we offer to all our students, for example, a student house, language center, and many others. But I would say that if you need any further information, I suggest you to come and visit our booth, and I will be more than happy to answer to all your questions. But if you want also to send me an email in the coming days or weeks, here are the contact information. So thank you again for joining, and enjoy the event now.
I'm just quickly reading through some of the questions we've had. I'm not sure if everyone's still here, and sorry if I'm not doing this pronunciation justice, but Sayeda asked, do I have to go to medical school if I want to study medical, like become or study medical esthetician or become a medical esthetician? I mean, as that is close to sort of like cosmetic surgery sort of thing, any kind of surgery related program would, require you to study medicine. There might, as far as I know, that would mean you would need to get a medicine degree first and then kind of transition into, surgery and cosmetic surgery further from there. In terms of neuroscience, Fania, it kind of depends on what you want to do in neuroscience specifically. I mean, there are neuroscience courses in the UK that are not necessarily a medical degree, where you can learn a lot about the brain and, to some degree, I guess even psychology courses can have a strong neuroscience part of the course as well. So no, definitely wouldn't require you to go to medical school first. But I guess it kind of depends on what you want to do, because for the surgery side, then yes, again, you would probably need to go to medical school first. But if you want to learn more about how the brain works and kind of do brain type studies and things like that, if you wanted to go into academics, then you would be able to do that without going to medical school. So research on the brain, you would definitely be able to do that without a medical degree. So I would say there are definitely courses, universities that have neuroscience courses. Southampton is one of them, but I'm sure there are many more. So I would kind of have a look at those universities, have a look at further options for that, and kind of have a look at the modules of each course as well. So like the study program you'll get to do to get a better idea of the kind of course that you're interested in studying. I think there's a question for you, Elisa, from...
I'm reading. Well, in terms of repeating a year, I would say it's possible. And let's say there are some exams you need to pass in order to continue with your degree. So yes, of course, it's not a problem if you still need to pass some first year's exam. There's always a group of tutors which are and their specific aim is to help our students to face the most difficult exam that we have during the first years of the medical path. So it's always possible, let's say, to in a certain way repeat the year. Hopefully we try to help our students to face all the exam and go ahead with their medical career. In terms of research, yes, of course, it's possible to do some curricular hours which are needed in terms of the completion of the medical career. In the research laboratories that we have, in fact, the research laboratories are really a few steps away from the campus where you will attend all classes. So yes, every year Humanitas University publishes some projects in order to work and to start studying during the 6 years program of medicine inside the research laboratories. Regarding the biomedical engineering, well, it's the MedTech degree course. It's a brand new course. There's anything similar in Europe. I would say that there's another course, for example, in Israel that merges the medicine with the biomedical engineering, but it's a little bit different because it lasts 9 years. So we are the only university that offers this course in only 6 years, and it's a really brand new course because it was born 2 years ago with the partnership of the Politecnico di Milano, which is another important university here in Milano. And it fully integrates the medicine with the biomedical engineering, starting from the very beginning of the course, so from the first year. And at the end of the 6 years, as I mentioned before, students are able to award the 2 titles. The first one is the Medicine and Surgery Master Degree, which is totally equivalent to the traditional medicine and surgery degree, let's say. And the other one, which is given directly by Politecnico di Milano, is the bachelor degree in biomedical engineering. So I would say it's a medicine and surgery degree course with a plus that allows students to start their career also in the biomedical engineering after the degree. Then
Yeah, I was kind of having a look at the other questions, but I answered some of them via chat while you were answering some other questions there, Elisa.
okay.
I think there was one more about IB score to be required. Did you cover that? Sorry, I might have missed that as I was typing.
Don't worry. Just to quickly answer, we accept the IB diploma regardless of the grade. So you only need to present your IB diploma and then to sit and to pass the admission test, and that's enough for us. Okay, I think we ran out.
We've run out of time, and I think we've covered all of the questions too. So I would like to thank everyone for joining us. As we've both said, if you have any further questions, you can email us as well. We've had there should be a recording of this as well, which the organizers will very likely and kindly share with you. So if you have any questions, you should be able to find our contact details on that as well. And please feel free to drop by our booths too if you have any questions. Anything you wanted to end with, Elisa?
Okay, you've said everything, I think. So thank you all for joining, and hope to see you soon, maybe also among our students. Thank you.
Yeah, thank you all for coming.
Thank you so much also, Joshua.
Thank you to Elisa. Have a lovely day.
Have a lovely day too. Bye-bye.
Bye. I can see someone has their camera
on. Yeah. Bye.